Personal protective equipment, the way it is used, is equipment you use to protect yourself from everyone else having the virus or having a disease or whatever, right? So that's what you see in the ER docs and the surgeons and the dentists. My kid and my wife have both had to go to dentists, and we've seen them in their full regalia. PPEs are meant to protect them from us. Regular masks, because these are not tight-fitting masks, we can't prevent outside air from coming in. Not everything comes through the filter. And so when you see a lot of the N95 stuff out there, yes, the filtration might be N95, but if it doesn't fit you properly, it could even be an N95 from 3M or Honeywell, a bona fide, proven, certified N95 mask. Most people don't know. When N95s are given out in hospitals, they have to go through a fit test, where they have to figure out whether anything's getting in around the seal, which is very interesting for doctors who have full beards, for example. It has to be fully sealed so that no air can leak in from the sides, so that all the air you're breathing has to come through the filter. And even the surgical masks, even the blue masks you see at the hospitals that doctors put on before they come to see a patient. Same boat, those are also not PPEs. Their main property is preventing water droplets, so spit and breath, from crossing that barrier. Their main property is moisture barrier. It is not microbe barrier. Why? Because most of the microbes that are respiratory, including SARS-CoV-2, are carried by water droplets. They're not freestanding. They're piggybacking. And so if you stop the droplets, we don't get the virus out. But all of these masks have leakage, right? If I breathe in, not everything I breathe in is coming through the filter or through the barrier. It's coming through the sides and the top. And so they're not considered PPEs. Even those blue surgical masks you see in the hospitals are not considered PPE because they don't protect the doctor absolutely to a whatever the risk margin is from disease. It is a preventative, but it is not a proven. So they're not considered PPE in that sense because they're not certified to protect you. They're meant to reduce your risk, but not to go to that level of personal protection. So cops wear, the vests, right? So consider a regular cop with a vest compared to a SWAT team who's in body armor. The vest protects you to a certain degree, but you're open in different ways and you can still get hurt or even killed. A SWAT member is covered from head to toe in body armor. Their risk of actually dying from anything is actually much less because they're armored, literally. So that's literally the difference that we're talking about here. Community masks, surgical masks are like the bulletproof vest that most cops wear. They're great. They cover the bigger pieces. They keep you safer. But are they absolutely safe? No. Cops with body armor can still be knifed. They can still have bullets in the wrong parts, and they'll still have severe injury. A SWAT team member probably won't. They'll probably walk away from most things. So that's really the difference we're talking about. So it's protective, but it's not protection.